The incidence of heart attack, stroke, or limb loss due to an arterial clot in COVID varies from 2 to 5%, you said. And I'm not showing the tweet here because you had put out a picture of a clot that you pried out of the lower limb arteries of a COVID patient. It was a bloody picture, and so I'm not putting it out here. But a question to you: are there more reports of COVID blood clots in the brain, hearts, lungs, or legs during this particular strain, which is active in the second wave?
What's interesting about COVID is that we're kind of learning on the fly. Through the year, we've been learning about the disease, and our understanding of the pathophysiology of COVID has evolved through the many months of this pandemic. And what happened was that early on in the course of the disease, as we were getting reports from China and New York and Italy, it was believed that the kind of illness that severe COVID is causing was similar to the acute respiratory distress syndrome that was noticed in other viral pneumonias. But subsequently, there were many extremely important autopsy reports that were submitted early on in the course of the pandemic, which revealed that what you're seeing is as much a consequence of microthrombi or microclots developing in the capillaries of the lungs as a direct attack on the lung parenchyma or the lung tissue. And subsequent to that, it was believed that COVID is as much a disease of blood vessels as it is a disease of the lungs. And blood vessels are everywhere in the body, and therefore it's entirely possible that the consequences of these clots developing would be seen in various parts of the body. So the virus basically attacks the lung, the inner lining of the air sacs of the lung, right? The adjacent neighbor of these air sacs of the lungs are the small capillaries inside the lungs. And it is also attacking the inner lining of the capillaries, the blood vessels inside the lung. And it is producing a kind of dysfunction inside these blood vessels and producing clots. Now, a clot is a colloquial term. The medical term is a thrombus. Now, a thrombus is the final product of a process called as coagulation. So when someone gets hurt, there's a cut on the skin or an incision, you will see that there is some amount of bleeding that is seen, but then it stops on its own. And this is an account of a process called coagulation. So liquid blood changes first into a sort of gel, and then it forms a kind of seal or plug, and that seizes the hemorrhage or seizes the flow of blood. And this is what happens in response to injury. But if these clots are developing spontaneously inside of blood vessels without any injury, they're going to form a plug or a cast within the blood vessel and completely cut off circulation to an organ or cut off venous drainage from that organ. All right. And this has been noticed as a direct consequence of both the viral attack on blood vessels and the immune response to the virus. So the thrombosis or the clotting that is seen in COVID has been called immunothrombosis. Okay, it's not plain old thrombosis. It's a combination of a response both by the attack by the virus and the immune response. It's like a category 10 hurricane that is set off within the immune system that is producing this thrombus. Now, the photograph I tweeted out was blood clots that I had retrieved through the lower limb arteries. And this patient presented with a sudden acute circulatory cutoff, which necessitated an immediate operation to retrieve the thrombus. Otherwise, this patient would have ended up losing his limb. An amputation would have been required. And in admitted patients of COVID, the incidence of developing such arterial clots is somewhere between 2 to 5%. And we've been getting hordes of such patients. In fact, this week we've done about 4 such cases back to back. One of mesenteric ischemia, which means an acute circulatory cutoff of the intestines. 3 of involving circulatory cutoff of the upper and the lower limbs.
So what should patients be really looking out for? I mean, how can is there something that people can do? Is there something that people like me can do? If you've got COVID, what are the things that you need to do so that clotting doesn't happen?
So one of the things we haven't figured out, and that's the puzzle we haven't unlocked, is who exactly is susceptible to the complications of COVID. Is there a sort of genotype that is more susceptible? Is there a kind of inherited mutation in a certain subset of people that is making them more vulnerable? Is there a deficiency of interferons, perhaps, or a specific kind of antibodies against some other interferons? What is it that is making you susceptible to the virus? And which is why it somehow feels like Russian roulette. You don't know who's going to go down. It's entirely possible that octogenarians, people in their 80s, are merrily surviving COVID and, are completely coming out completely unscathed and unaffected. And you find 30-year-old people dying of stroke and other complications and ending up with severe lung afflictions. So you really don't know who is going to suffer. That's the bit we haven't unlocked. But what we have realized that in the course of the illness, if there is a sudden rise in the inflammatory markers, which is why many individuals are advised to get a set of blood tests done around day 5 and perhaps track these tests if required subsequently. If there's a sudden escalation in some inflammatory markers and a rapid escalation in the inflammatory markers, it's highly likely that these are the individuals who might suffer complications of COVID. And one of the complications is obviously blood clots. So, which is why if you are falling in that category, you must constantly be in touch with your physician. And if any new symptom were to develop in any part of the body during the course of your illness, you are supposed to report it to your physician and get it properly investigated. If there's a clot developing in the veins, which are the blood vessels draining a certain part of the body, for instance, if there's a clot developing in the lower limb veins, there will be swelling or pain of the legs. If the clot were to dislodge and suddenly travel to your lungs, you'll be acutely and suddenly breathless, because breathlessness doesn't happen acutely and suddenly in COVID. It's more insidiously played out. But if there's sudden onset breathlessness, that could be an indication of pulmonary embolism or a clot migrating to your lungs. And if arterial clots are developing, there will be sudden excruciating pain in a part of your body, perhaps your extremities or perhaps in your abdomen, or signs of, and symptoms of a heart attack, which is a sense of pain and constriction and tightness in the chest, or pain radiating from the chest to the left arm or to the jaw, or sometimes to the back. There could be lightheadedness and other such symptoms. There could be transient ischemic attacks of the brain, which could manifest in the form of sudden onset weakness in a part of the body, or transient or paralysis of a part of the body, or a sudden loss of consciousness, or visual disturbances, or slurring of speech, or something like that. So any new symptom that's developing in the course of the illness should immediately be reported and investigated.